let's just take a look at the number of COVID cases in Scotland to explain the action that was taken today by the First Minister. So let's look at the standard measure of the number of COVID cases. That's the number of COVID cases per 100,000 of population. And there you have that figure in Scotland. It is 90. Now, Lewis was talking about how there are much tighter restrictions in the Central Belt. So let's look at the Central Belt. There you are. That's the main population area in Scotland, going from the Glasgow conurbation in the west over to Scotland, over to Edinburgh in the east. And let's just take a breakdown. Let's have a breakdown of the figures in that area, those high levels. So there you are, the Greater Glasgow Clyde area, 176.5 per 100,000. Lanarkshire is 152 per 100,000, and Lothian, that is 126. Now, let's just compare that. How does that compare with England? So let's again look at that standard measure of per 100,000. So there you are, Scotland is 90. In England, it is noticeably higher. But let's just do a comparison with the highest regions in Scotland. There you are, we've seen them before, and look at the highest regions in England. Liverpool, 552 per 100,000. Manchester, 542 per 100,000. And Newcastle upon Tyne, 480,000. Now, it's important to say you can't do an exact like-for-like comparison because the time frames there are slightly different, and they're slightly sort of different regions, but different sorts of regions. But what I can tell you is one member of the government has told me that those figures in the northwest and the northeast of England, they're describing as very troubling. They're talking about increased hospitalisations and a growing number of elderly people in intensive care. So those regions, they are going to be placed in the highest of 3 tiers to be announced next week, possibly on Monday, in a new system in England called the local COVID alert level. So in that top tier, you will have extra restrictions on the hospitality sector. The next tier down, that will be the equivalent of what you have in current local restrictions. And the final tier, that's known as tier 1, that will be the least affected areas, the lowest levels of COVID, and that will be the current national restrictions on, for example, the rule of 6. Now, the government knows that it has to act fast, but there is a very big debate in Cabinet about just how far to go. So some in number 10 are saying that that new top tier, well, that needs measures like Scotland. But I spoke to one of the Cabinet hawks. These are the ones who are wary of lockdowns. And this minister said to me on the idea of following Scotland, I hope not. It's fair to say that discussions are underway. One thing we do know, Rishi Sunak will be coughing up extra cash next week to ease the blow of the new restrictions. Emily.
Nick, thanks very much. So how are places with tighter restrictions faring? The Labour leader Keir Starmer suggested that 19 out of 20 places under restriction have seen infection rates rise. You heard Nick there just mention Liverpool in his data, and our health correspondent Deb Cohen has been there today.
Knowsley, like much of northern England, has faced tougher restrictions, and it's bracing itself for even stricter measures. Uncertainty here is keenly felt.
I've made you some nice scouse.
Oh, lovely.
And a nice bun.
Smashing.
Jan Owens runs a community centre here. She's delivering food to those who are alone.
The impact of social isolation has been the worst, I think, out of everything, because, I mean, as you see today, a lot of these people live on their own. They see nobody at all. And then to think that they're going to go, well, we may be heading for another complete lockdown again. People are really scared. I think people are fearing, as well as the businesses, losing their homes. And with the impact of the social isolation, people have just started going back out. People have just started going into doing the shopping. And then if it's going to be a total lockdown again, we're going to have a couple of weeks, months of not going outside at all. I think the impact of that is going to be absolutely awful.
It's early days, but despite current measures, Knowsley, along with neighbouring Liverpool, have 2 of the highest rates of COVID cases in the country. But if you look at the others in the most affected areas, they're all in the northwest and northeast. Here we can see how sharply the cases in the northwest are going up, but they're not always the most reliable metric. The hospitalisations are increasing too, but they're still lower than earlier this year. It's usual for admissions for respiratory illness to go up around now, but 4/5 of Liverpool's COVID-19 beds are full. The Royal Liverpool and Aintree hospitals account for 1 in 5 of the COVID-19 patients in the North West.
There is no one single right answer. There's no one single thing that's going to sort this out for all of us, except perhaps a vaccine in 12 months' time. I think the reality, though, is that the evidence is still emerging. This is such a new virus. We're all going through it together, and the learning is really, really rapid. We just need to do that learning together.
This is a region that has several stories. One is of an influx of students to its multiple universities, and another is of deprivation, which is known to be associated with poorer COVID outcomes.
Areas like this in Liverpool were hit in April and May, and there are fears that COVID may be taking its toll again. There are various explanations for this, but one thought is that policies were made with an eye on London.
Well, first time round, it looked like our levels of infections was in line with everybody else. It's just that the results, the outcomes as a result of those infections were worse. And as I say, I think that's due to the existing inequalities, existing levels of deprivation, existing levels of poor health. This time round, we've seen much higher levels of infections and very quickly increasing. And I think that's because we've come out of lockdown earlier for the Northwest than perhaps it should have done. And that's meant that the embers are still burning. So it's been easier for the virus to ignite and to take off very quickly.
As the cases continue to rise in the north, there are big decisions ahead for this part of the country that has already had more prolonged restrictions than most of the south. How do you stop COVID from spreading whilst protecting people's well-being and deepening any economic north-south divide?